next skill we're gonna do is bedpan. Bedpan to me is pretty simple if you just follow these steps. And I know that when you see me do these videos, it's like, Mr. Golf, you don't go in steps, okay? Or you don't go in order, because some of the skills that you're doing is just a natural response, a natural movement. And what you got to think about is two things when you're doing these skills. One is I want to make sure I hit all my steps and the bow. Got it? Two is that I got 30 minutes to do what? 5 skills. Got it? Even though these videos are running like, 3 minutes, 2 minutes, or 10 minutes, and that's because I'm just talking, okay? But I'm gonna show you bedpan, and I'm gonna walk through it first, and then I'm gonna actually do the skill, okay? So when you do bedpan, the things you wanna have is toilet paper, you wanna have what? Hand sanitizer, and you're gonna have your baby wipes. Take all this first, place it on the table, got it? Take all that first, place it on the table. Understand, I'm gonna have gloves on, but take all that first and place it on the table. Then go get your bedpan. When you go get your bedpan, and I'm gonna move this blanket down so you can see, got it? When you go get your bedpan, good. You're gonna have on what? 2 pair of gloves. You're gonna grab the bedpan with your dirty hand, with the gloves on, with your dirty hand, and then you're gonna go right in, grab everything, the blanket and her waist, and ask her to do what? Lift up. Got it? Good. Ask her to lift up. Ready? 1, 2, 3, lift up. Don't turn, lift up. So you want them not to turn, you want them to do what? Lift up. Ready? Bend your knees. Good, and lift up. Good. When you go in, this goes here, come around and turn. Got it? Place her right on. Good. Got it? Good. When you remove it, it's the same thing. Clean the hand. Good. Lift up. Grab it. Come around and what? Turn. Then we're going to do the steps. Got it? Understand this. For Virginia Board of Nursing, you don't have to put a chuck down for what? Your test. You don't have to do it. Real life? Yes, do it. But for state boards testing in Virginia, you don't have to put a chuck down. So what I'm gonna do is, since I showed you how I actually go, I'm just gonna walk you right on through it now. Good. I'm gonna walk you right on through it. Okay? So here we go. Bedpan. How you doing, Ms. Johnson? My name is Mr. Golf. I'll be your CNA today. Before I get you started on what putting you on the bedpan, I'm gonna go wash my hands, put my gloves on, provide you what? Privacy. So I wash my hands, I go put my gloves on. This is a glove skill. I'm gonna what? Provide privacy. I'm gonna gather my supplies here, place it on the what? Table. Last thing I'm gonna gather is what? My bedpan. So I'm gonna take my bedpan, my clean hand, ensure that what? The bed is laying supine. I'm gonna ask her on the count of 1, 2, 3 after I gather all the sheets and covers and her waist. 1, 2, 3, lift up. Good. Come in and turn. Good. I immediately remove my gloves, wash my hands, put the supplies right up front, and raise her bed. I'm gonna raise the bed up to what? 75 to 90 degrees. I'm going to ask her to touch each one. Please touch each one. So touch it with the opposite hand also. Good. She's able to touch each one. Now I'm going to give her instructions. All right, Ms. Johnson, when you finish with using the bathroom, take the tissue, wipe this up, the wipes to do what? Wipe your hands, and hand sanitizer to what? Sanitize your hands. I'm gonna give her the call bell. Place that in her hand. When you're ready, please use the call bell to let me know, okay? I'm stepping out. You step out. She hit the call bell. You come in. You come in. You immediately go and get your gloves. Wherever your gloves is located at, you want to get your gloves, okay? You put your gloves on. For dignity and respect, you take what? Some wipes. Ask for a hand. And you go 1, palm, 2, over top, fingertips. Same thing. Over top, palm, fingertips. Good. I take all this. Good. You like some hand sanitizer? Swap. Put it in there. Good. Take all this. Throw this away. Place this in the designated dirty area. I come back. I remove my table. And I'm lowering her bed. The longest process about bedpan is that the bed got to be lowered. You got to be raised up and you got to be lowered. And you lower the head till it becomes flat. Person laying in supine position. Good. Again, I grab all her covers with my clean hand and her waist, and I ask her on the count of 1, 2, 3, lift up. 1, 2, 3, lift up. Good. I turn without letting it touch any of the covers. Good. I take it, go right to the toilet. I dump paper towels. I rinse. Do not dump this back into the sink. I rinse and I dump right back here, back in the toilet. We do not dry bedpans. I place in the designated dirty area. I go back, do my 3-part step. Pinch my gloves off my hand, in the palm of my hand, 2 fingers underneath. Take it, dispose of it, simulate washing my hands. I'll give her a call bell in hand. Good. I make sure the beard is what? Lowered. I do what? Remove privacy. I document, task complete.